This was very recent. MS sufferer walks after stem cell treatment. An Australian man who was confined to a wheelchair by multiple sclerosis has made a remarkable recovery after receiving a groundbreaking stem cell treatment. This individual was diagnosed with the disease in 2008 and lost his ability to stand within a few months. The treatment targets the immune system of multiple sclerosis patients. Doctors carried out a new technique to remove stem cells from his bone marrow, his own bone marrow, before using chemicals to destroy his immune cells. The stem cells were then transplanted, or I guess it should sort of be replanted, back into this individual's body to replenish the immune system, effectively resetting it. Now, the interesting thing about that, to me, is that, you know, there was all this controversy and all this hoopla about stem cells and the ethical issues surrounding stem cells, but yet these articles are focusing on taking the patient's own stem cells, whether from fat cells or now the more, I think probably the more promising choice would be bone marrow, and replanting them or transplanting them into back into the individuals. And I think stem cell therapy was really backburnered far too long for all the wrong reasons, because clearly there are other choices other than embryonic stem cells out there, and I think that the focus for the future should really be on this stem cell technology. The next one is near and dear to my heart because it is about MS, and it was tremendous news, which was so big that that the media just couldn't ignore it, and thankfully the Globe and Mail was one of the newspapers in Canada that actually did a major article on it, and that's about chronic cerebro-spinal venous insufficiency called CCSVI, and man, doesn't the medical community love acronyms. But in this case, CCSVI is a whole lot easier than saying that other thing. And what this is all about is very interesting. I'm going to read this a little bit and then comment on it. For many people with multiple sclerosis, the internet has been buzzing. The internet has been buzzing all over the United States and actually really all over the world about CCSVI. There was a study published last month. Just in case you haven't heard, the study was done by a doctor in Italy, Dr. Paolo Zamboni, and I know, odd name, sorry Dr. Zamboni, but it's hard not to smile when you say that, especially knowing a Zamboni is the thing that cleans ice. Anyway, he and his colleagues published in a peer-reviewed journal, the Journal of Neurology, Neurosurgery, and Psychiatry in November this year. They conducted research and found that 86% of MS patients in their study groups had a narrowing, twisting, or outright blockage of the veins that are supposed to flush blood from the brain. They also found the blood of MS patients refluxing, which means flowing back upwards to the brain, which they believe sets off a number of reactions, including possibly the symptoms that characterize MS with the so-called liberation process, which is what it's being called. Dr. Zamboni inserted a tiny balloon into these blocked veins to free the flow of blood out of the brain of 65 patients. It's similar to what is done in heart surgery with angioplasty, those little balloon things. They showed remarkable improvement, and the active sclerosis for the group dropped from 50% to 12%, big numbers, and 73% of the patients had no MS symptoms for at least 18 months. Now, this is huge news because MS, as many of the so-called autoimmune diseases, have been lumped into this autoimmune category for lack of any other place to put them, because modern medicine simply really doesn't understand what's happening with any of these things. But in this case, this looks like MS may, at least in some patients I'm sure, will prove to be more mechanical in nature. It's something that I discuss in my book, The Difference Between Disease and Condition, And I definitely theorized back some 4 or 5 years ago that MS was a condition and may well be mechanical in nature, as opposed to strictly immune in nature, the immune part being just a response to something else that was happening. And so that completes this short list of things. There's tons of other things happening out there today that you need to be aware of. And clearly, if you're sitting here watching this video and are shocked that you haven't heard of some or all of these things, it should be clear to you that you need to be proactive, you need to be on top of what's happening out there, you need to be taking a look at not only the mainstream media, but certainly what's happening on the internet. I'm not trying to promote my book, but I do talk about in my book how to use the internet efficiently and effectively without scaring yourself to death. And I would like to take this opportunity to thank Suzanne Summers, who wrote an excellent book, really a must-read on cancer, called Knockout. I've enjoyed pretty much all of her books and think she does a fine job and works with some tremendous people in producing those books. Suzanne kindly mentioned my book on page 311 of her book as recommended reading, so thank you very much, Suzanne. And I really would urge you and certainly encourage you to be proactive and to be checking on a regular basis what's happening in the news, and the news should certainly include scouring the internet, searching the internet. There are ways to set up your search engines so that they can do that automatically for you, so that you can ask good questions based on current and best information. Because at the end of the day, from a patient's perspective, what this is all about is getting your best possible outcome. And I think it's becoming clear that in order to get your best possible outcome, you need to be not only proactive, but you also need to be looking at an integrative approach, and you need to be choosing your doctors carefully, and they should be wanting to work with you, and they should be encouraging you to be curious and to be proactive and to play an active role in your treatments. Thanks for listening today. I appreciate all the emails that I've received on my past YouTubes and with respect to my book. Thank you very much, and I hope to be doing several more of these shortly.